I'm always skeptical when it comes to medications. Unlike other non-surgical options for thyroid eye disease, can actually stop the progression of thyroid eye disease. So it sounds promising, and a lot of ophthalmologists like it. In this Q&A episode, I am going to answer the question, when should Tepezza be considered for thyroid eye disease? It could be challenging for some people to determine risk versus benefits. I have had one male patient temporarily lose their hearing, which is one of the big side effects of Tepezza, temporarily, or tinnitus. And even if that's temporary, again, to have ringing in the ears for a few months is bothersome. If we knew that it would just be a few months and that Tepezza would fix the bulging, then maybe it would be worth it. So you want to take the risk that you potentially can lose your hearing. Hey, this is Dr. Eric, and in this Q&A episode, I am going to answer the question, when should Tepezza be considered for thyroid eye disease? So let's start off by briefly discussing what Tepezza is. I have mentioned this in other podcasts. I interviewed Dr. Ronnie Bannock, who's a neuro-ophthalmologist, and she spoke about Tepezza, but I'll briefly mention that it is a fairly new medication. It's been around for about 5 years now, and in thyroid eye disease, apparently insulin-like growth factor 1, or the receptor, forms a complex with the TSH receptor, and inhibiting this complex can greatly help people with thyroid eye disease. And so the way Tepezza works is by binding to an insulin-like growth factor 1 receptor, and this in turn causes degradation of the antibody receptor complex, and this in turn can potentially help to decrease proptosis, double vision, as well as other symptoms associated with moderate to severe cases of thyroid eye disease. It's not something that you want to consider in mild cases, and maybe something you don't want to consider even in moderate to severe cases. That's what I'm talking about this here. Now, unlike other non-surgical options for thyroid eye disease, such as taking corticosteroids, Tepezza can actually stop the progression of thyroid eye disease. So it sounds promising, and a lot of ophthalmologists like it. Maybe that number has decreased because of the side effects, and that's definitely has scared me. I mean, I'm always skeptical when it comes to medications. And again, there's time and place. So, I mean, I have a lot of patients with Graves' disease taking anti-thyroid medication, and even that has side effects, or a lot of times it does, not in everybody. But everything comes down, of course, to risk versus benefits. And that's really what this Q&A episode is about, really just for those who might be thinking about taking Tepezza. Is it something you should consider? And if so, like, when should you consider taking it? So first of all, I will say that if it's not covered by like your health insurance, you're probably not going to be able to afford it because it's a few $100,000. And so that's one thing, is making sure you get pre-approved for Tepezza if you do decide to take it. But the benefits, I've had a number of patients take Tepezza, not a lot. So it's not like I've had dozens of patients take Tepezza. Most of the time they're working with me to try to prevent taking things like Tepezza or getting thyroid surgery for the eyes, TED surgery. But there are some cases where they're working with me to address the autoimmune component, but they still have taken Tepezza either. I mean, most of the people have taken it prior to seeing me, like they started working with me and they're already taking it. And I've had like one or two that started taking it after seeing me. Just usually, I mean, as far as I remember, again, it's only been I know one, they took it probably like a month or two after working with me. So it's not like they were really relying on my treatments to help with the thyroid eye disease. They were working with me for the autoimmune component, and then they just decided to get the treatments while still working with me to address the autoimmune component, but just because the eyes were affecting the quality of their lives. So again, very small sample size of patients. I have had one male patient temporarily lose their hearing, which is one of the big side effects of Tepezza. And some say it's like 10%, and you can look at it as good and bad. Like 10% to me is a high percentage, but you could look at it the other way and say, wow, there's a 90% chance I'm not going to have my hearing affected. And out of those 10%, I'm not sure what percentage is permanent. or again, long-term, because it's not like it's been around for a real long time. So maybe someone loses their hearing for like a year or two. In the case of the male patient I worked with, it was a few months. I say only a few months, but again, even a few months losing your hearing is not good. Some people develop tinnitus with a ringing of the ears. And then when just doing like a search, it also mentions other symptoms like muscle cramps, nausea, hair loss, diarrhea, high blood sugar. It says if you have inflammatory bowel disease, so Crohn's disease or ulcerative colitis, that Tepezza may make the IBD symptoms worse. It may also cause an increase in your blood sugar. And so if someone's having moderate to severe bulging, this is where Tepezza can really help. And that's where it could be challenging for some people to determine, well, risk versus benefits. I might get this treatment. And this happened with the recent patient who decided to get it. And so far, everything's okay, at least as of recording this. She hasn't lost her hearing. She hasn't gone through all the infusions. I failed to mention earlier that there are 8 infusions, 3 weeks apart. And again, I go into more greater detail in my other podcast episodes, as well as I have an article. So I can include the links to those in the show notes, which you can check out by visiting savemythyroid.com. But this person, she only was working with me for a month or two. And then she just decided, hey, I'm going to get the Tepezza just because I'm scared about my eyes getting worse. And it's really affecting quality of life. And it seemed like it was helping relatively quickly, I believe, after only the second infusion. And last I spoke with her, I think she went through 4 infusions and still had her hearing. And that's according to some doctors, that's when usually if someone's going to lose their hearing, it's not going to be after the first infusion or two, but after the 4th infusion. Again, I'm not sure how true that is, if there have been people who lost hearing after 1 or 2 infusions. But either way, just something to consider, that if you lose hearing, it might not happen until after the 4th infusion. But with her, it helped. With the male patient who lost his hearing, it helped with the bulging, but he also had double vision and it did not help. Now, this recent patient I'm working with, I'm pretty sure she does not have double vision. And then another patient comes to mind that had the bulging of the eyes, the proptosis, but not the double vision. And it did seem like it was helping her. So, I mean, again, it does seem like it has a lot of success with the bulging. It's just a matter of risk versus benefits. Do you want to take the risk that you potentially can lose your hearing, maybe temporarily, or tinnitus? And even if that's temporary, again, to have ringing in the ears for a few months is bothersome. But again, if we knew that it would just be a few months, like if someone would get ringing in the ears for 3 months, or hearing loss for 3 months, and the Tepezza would fix the bulging, then maybe it would be worth it. If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. Something else to consider, of course, is that Tepezza isn't addressing the underlying cause of the problem. If you do some research, it'll say it's addressing the cause, but it's not removing the triggers of the autoimmune component. It's not addressing the autoimmune component. I mean, it is possible that someone could go through the 8 infusions and it could help, and that in the future, the bulging might return. So that is a possibility. There's also the possibility, which I didn't know until I interviewed Dr. Ronnie Bannock, that some people might need more than the 8 infusions. So I'm pretty sure during an interview we had in the past, she said that she's had some people go through like another round of 8 infusions. And I forgot if they experienced any improvements. I'm thinking maybe they had some improvement during the first 8 infusions, but there was still room for more improvements. And obviously need to get that second rounds approved by your health insurance. it can be a challenging decision. I can't relate with anybody because I didn't personally when I dealt with Graves, I didn't have thyroid eye disease, or if I had, it was very mild. And if I had moderate to severe thyroid eye disease, would I consider Tepezza? I don't know. I mean, it's easy for me to say no way would I consider it when there's a risk of losing my hearing or tinnitus. And I think that's how I would lean. I'm pretty sure I would probably not take the Tepezza if I had moderate to severe thyroid eye disease. But again, I don't have it. So if it was affecting quality of life, affecting sleep, and the challenge is choosing between that and thyroid surgery, because again, there are some people you could say, oh yeah, well, they shouldn't do either one. But again, it's easy to say when you're not dealing with that. So if I was dealing with moderate to severe thyroid eye disease, and if it wasn't improving, if I was, let's say I was doing things to address the autoimmune component and it wasn't improving, because again, the greater severity of thyroid eye disease, the less likely someone is to respond to natural treatment approach. I didn't say that earlier too. I've said that in other podcast episodes, but again, if I'm working with someone with mild to moderate thyroid eye disease, I'm pretty confident that we could get good results. If someone has more severe thyroid eye disease, we might be able to get some changes. Will we be able to get them back to where they were prior to developing thyroid eye disease? Again, it's less likely. So I'm not going to say never that we can't, definitely can't, but it's more challenging. So that's, again, something to consider. And those are the people who are going to get Tepezza. They're not the people with mild thyroid eye disease, but more, again, moderate to severe. So if someone's like in that moderate category, and sometimes it's hard to differentiate the moderate from severe, but if, again, someone could always try to give the natural approach a try and see if it helps out. But that does take time. That could take a number of months. And some people don't want to do that. And it's hard for me to criticize them since I'm not in the situation and I haven't been in that situation. But just some things to consider. So, I mean, as far as getting back to the original question, when should Tepezza be considered for thyroid eye disease? So I would say if someone is experiencing severe thyroid eye disease, maybe something to consider. Again, especially if someone has tried taking a natural approach, they've done things to address the autoimmune component of Graves and thyroid eye disease, which of course I've discussed in other podcast episodes. If they've done that and then they're deciding between surgery and Tepezza, again, that's something I'm not saying go for the Tepezza or go for the surgery. Like I said, it's a tough decision, something that you might have to get multiple opinions on, because there are people that get surgery for thyroid eye disease and they end up getting multiple surgeries. Like if it was one surgery and it would fix the problem, then that would be one thing. But there are people that get 2, 3, 4. I think I've had I think 1 or 2 people that I know had 5 surgeries for thyroid eye disease. I mean, so 1 or 2 alone is bad enough, but 5 is crazy. And then of course, if someone sees me and they've already had like even 1 or 2 surgeries, then it's more challenging for a natural approach to work. But many of these people, when they see me, they're not expecting miracles. They still know that, well, hey, I have that autoimmune component, and they're not only dealing with thyroid eye disease, but hyperthyroidism related to Graves. So they're looking to get that addressed. So, but anyway, like I said, it's not an easy question to answer as far as when should Tepezza be considered. Again, severe thyroid eye disease, maybe, but only you could decide whether the risks are worth the potential benefits. So as usual, I hope you found this Q&A episode to be valuable. And of course, I look forward to catching you in the very next episode.